Good afternoon, everyone. Welcome to today's COVID-19 update in Alberta. With us today is the Minister of Justice and Solicitor General, Casey Madhu, and Dr. Dina Hinshaw, Chief Medical Officer of Health for the province. Minister Madhu will provide a brief update, followed by Dr. Hinshaw, and then we will open the floor to questions.
Thank you, Thom, and thank you, everyone, for being here this afternoon. Since the start of the COVID-19 pandemic, the government of Alberta has struck a balanced approach, one that protects the health of all Albertans without placing undue restrictions on personal freedom, protecting both lives and livelihood. But the fact remains that an estimated 40% of traceable COVID cases can be linked to private social gatherings. It's clear that if we want to slow the spread of this virus, to protect vulnerable populations and our healthcare system, private social gatherings are the obvious place to start. The potential health consequences of doing otherwise are simply too serious for us to ignore. And so, as Premier Kenney announced on Tuesday, those who choose to break the rules will be subject to fines. Depending on the nature of the infraction, fines could be as low as $1,000 per ticketed offense, or in extreme cases, as high as $100,000 through the court system. People need to be responsible for their own actions by treating the pandemic as serious, and so too will be the consequences for not following the rules. Developed by Alberta's Chief Medical Officer of Health, Dr. Hinshaw, to help protect you and your family and friends from getting and spreading COVID-19 pandemic. To reflect the current health risk, we are temporarily increasing the number of peace officers who can sanction fines against those who break the rules. Currently, enforcing public health legislation is handled by police, health inspectors, and Level 1 Alberta peace officers. Now, on top of this, I am temporarily extending this authority to about 700 more officers, to both certain Level 2 Alberta peace officers and Level 1 community peace officers. This means Alberta peace officers who are Level 2 and work in ministries outside of my department, and Level 1 community peace officers who are employed by municipalities across Alberta. Both already have the training and experience necessary to enforce public health orders if required during a provincial emergency. To be clear, we are not asking these officers to stop code their day-to-day priorities or to harass responsible Albertans going about their everyday lives. As the Premier said earlier this week, this is not by preference, but because of the reality we face as a province. As elected members of Alberta's government, we are simply making sure that more enforcement is available to respond quickly and decisively to situations where groups are breaking public health measures and thereby endangering the health of their community. On behalf of Alberta's frontline healthcare workers, the families who have lost loved ones to this terrible pandemic, the men and women who risked their lives saving lives, to start a small business, to children who have had their education disrupted, to the men and women who have risked their life savings, I am asking all Albertans to do the right thing by stopping social gatherings in their own homes. Many Albertans are already taking the necessary precautions, as recommended by the Chief Medical Officer of Health, to protect both lives and livelihood. By avoiding social gatherings, to wearing masks, to cooperate with law enforcement officers, and take common sense steps to fight this virus. To everyone who is doing this, thank you. And to those who refuse to accept the reality of the situation, I understand that this is an extraordinary encroachment on your personal liberty. But you must accept these temporary measures. This is the time for Albertans to stand together. Thank you. And I will now invite the Chief Medical Officer of Health, Dr. Hinshaw, for her daily remarks.
Thank you, Minister. And good afternoon, everyone. Before I begin, I'd like to encourage every Albertan to work with the law enforcement members and Alberta Health Services health inspectors who are working to enforce the rules that are in place. As I have said all along, we are all in this together, and we are all on the same team. I continue to hear some disappointing reports of AHS public health inspectors being criticized or worse, verbally abused as they go about their jobs. Nobody deserves that, least of all the people who are working to keep all of us safe. The criticism and verbal abuse that they are currently facing does not reflect who we are. I'm asking everyone to please cooperate with them and to treat them with respect. I know that the restrictions currently placed on all of us are difficult, but they are not the fault of law enforcement or inspectors who are simply trying to enforce what is in place and to help stop the spread. Turning to today's case numbers. Over the last 24 hours, we have identified 1,227 new cases of COVID-19 in Alberta and completed more than 16,200 new tests. Our provincial positivity rate currently sits at about 7.6%, and we now have 14,217 active cases. There are 405 people in hospital, including 86 who have been admitted into the ICU. Sadly, there were 9 deaths related to COVID-19 that were reported to us in the last 24 hours. I think often about the tragic impact that this virus has had on many Albertans. Not only those who have lost a loved one, but everyone who has suffered from COVID-19 or been impacted by the restrictions we have used to prevent spread. This is a hard time for all of us, and we need to continue to support one another through the many challenges. In schools, there are currently active alerts or outbreaks in 356 schools, about 15% of all schools in Alberta. Currently, these schools have a combined total of 1,326 active cases. This number includes 193 schools with outbreaks, including 89 currently on the watch list. Starting Monday, all students in grades 7 and above will shift to at-home learning until January 11th. Schools are an essential part of our children's health and well-being, and I know that this will be difficult for many. I would like to thank everyone for their efforts and flexibility as we make this transition. I would also like to remind everyone living in enhanced status areas that many of the restrictions for businesses and services announced on Tuesday are coming into effect today. I have issued a new order, number 39/2020, that legally brings these restrictions into force. This order will be posted later today. I urge Albertans to exercise patience and kindness in the days ahead. If a line is a bit longer than usual, or an employee asks you to follow a new policy that is in place, please do not take your frustrations out on these workers. These new restrictions and measures create extra work and pressures for staff, owners, and operators. I am grateful to each of them for taking them seriously and putting them into effect to closely follow each of the public health orders. You play a critical role in bending the curve. That being said, I also encourage employees and operators to show patience for customers who may not know new measures are in effect, or who may need your help understanding what they need to do. I know that there are many new restrictions in place, so today I wanted to touch on a few areas we've received questions about. I've been asked whether the restriction on group performances is still in effect for enhanced areas. This was originally announced in mid-November. It prohibited any group performance activity, including singing, dancing, and theatre, though not in professional performance venues or as part of ordinary school classroom activities. This ban will remain for enhanced areas. It does not apply to individual one-on-one settings, so singing or piano lessons, for example, can still occur with appropriate precautions in place. I have also been asked whether mutual support groups like Alcoholics Anonymous, Narcotics Anonymous, and Smart Recovery can continue to meet in person with these new restrictions. Mutual support groups are critical to preserving Albertans' health and well-being. They may continue to operate in person without capacity restrictions as long as physical distancing of 2 meters is maintained between everyone. However, I am encouraging these groups to consider conducting virtual sessions where possible. This is to reduce in-person interactions, but also support those who may not be able to attend in person. I also wanted to clarify a couple of points about the new restrictions for places of worship. In enhanced areas, masking is mandatory for all attendees. I've been asked whether that includes times when someone is speaking at a podium far away from others. In those cases, speakers may remove their mask while speaking at the front, provided they maintain at least a 2-meter distance from all other individuals. Once they've finished speaking, they are required to put their mask back on. We have also been asked whether group studies in private residences and home-based worship sessions can continue. These types of gatherings are not permitted in private homes. This means any in-home session with members of different households need to take place virtually or be put on pause just for a few weeks. I want to be clear. For the next few weeks, every one of us needs to dramatically reduce the amount of contact we have with people outside our own household. This weekend, I am asking all Albertans to embrace this challenge. For the next 2 days, do everything you can possibly think of to help bend the curve. This does not mean you can't enjoy life. If you're able to, please get some fresh air and make the most of the mild weather we're expecting. Reach out to someone, whether by text, by phone, or email, to let them know that they are not alone and that we are all in this together. The decisions that each of us make this weekend will help determine whether cases fall or rise in the weeks ahead. So please be wise, be safe, and let's all look out for each other. Thank you, and I'm happy to take questions.
All right, we'll go to the phone line now. Operator, could you put through the first caller, please?
Thank you very much. The first call is from Kevin Nimick of CTV Calgary. Kevin, your line is open.
Hi, Dr. Hinshaw. Ontario says it'll be ready to start COVID-19 vaccinations on December 31st. Quebec says January 1st. When will Alberta be ready to start?
We're working hard with Alberta Health Services and other partners to do our planning with respect to vaccine. And we're working with the federal government, who has been procuring the vaccine, so that whenever vaccine is ready, and that is unfortunately at this time a bit of a moving target in terms of when that vaccine might be available, but our goal is that whenever vaccine is available, we will be ready to start immunizing individuals on that highest priority list.
Excellent. Operator, could you put through the next question, please?
Thank you. Julia Wong, Global News.
Hi, Dr. Hinshaw. The Edmonton Zone Medical Staff Association has created their own COVID-19 pandemic committee, saying there's been loss of faith in the government. What's your response to this committee forming? Are you open to working with them, and will you consider their recommendations?
I am always grateful for colleagues who are working hard to make sure the public has accurate information. It's my understanding from speaking with colleagues that some of the concerns this group is wanting to address are concerns about fellow physicians who have made inaccurate or misleading statements in the public. And so I'm happy, of course, to work with any colleagues who are doing their best to make sure that the public has accurate information about the severity of COVID-19 and how serious it is and why we must address it together.
Operator, could you put through the next question, please?
Tanya Faubert, Rocky Mountain Outlook.
Hi, Dr. Hinshaw. According to the relaunched status map, Banff and Lake Louise have one of the highest rates of cases per 100,000 in the province. Can you provide any details on the source of transmission for these increasing numbers in these two communities? Are there any outbreaks that are in either Banff or Lake Louise? And what is being done to ensure those who live in staff accommodation, which often use shared rooms and living quarters, are appropriately isolating and quarantining?
When it comes to addressing outbreaks or managing local spread at that local granular level, I really rely on my colleagues at the front line. So in that case, it would be my medical officer of health colleagues in the Calgary zone who would be working with Banff and surrounding areas. So Alberta Health Services would potentially have some additional information about those sources of spread in that particular area. But what we know across the province is that when people are spending time in close proximity to one another, whether that's because they're, again, you mentioned the shared accommodation. I don't have details on whether or not that's a part of the spread, but certainly we know that when people are sharing common areas, sharing bathrooms, sharing living spaces, that is a risk for transmission. As well, of course, as has been said here, social gatherings are a significant source of transmission in general, and we can work with Alberta Health Services to see if they can provide some additional detail about that local area.
Operator, could you put through the next question, please?
Harry Tate, Globe and Mail.
Hi, Dr. Hinshaw. I'm wondering if you can explain a little bit more about how the health system intends to create 400 ICU beds for COVID patients and 2,000 acute beds. You talked about moving people to continuing care quicker, but there's beds blocked in that system. The wait list is longer. I'm wondering if you can be a little bit more specific about what we'll lose, what will the expense be, and where this is going to physically happen.
Sure. I think Alberta Health Services would have a lot of the details you're looking for if you're looking for specific sites and specific logistics. So I don't have that level of granular detail. What I can tell you is that there is work underway to expand capacity in the continuing care system to be able to create beds where people who need additional care and can no longer have all of their needs met at home, that those individuals will be able to have beds to go into, and those who are in hospital waiting for those places to open, that additional capacity will be created within the system. There's a lot of work going on to do that. Also, we know that in some cases, individuals who are waiting for placement, sometimes it's a staffing issue, so we're working very hard on looking to see how staffing can be enhanced. And again, Alberta Health Services would have more details on exactly how that's being done. And then, as I've said before, unfortunately, part of the way that we enhance capacity in acute care is by creating space where individuals who have a care need, for example, a scheduled surgery that can be delayed, some of that capacity is being opened up by delaying those surgeries that can, so that the space is opened for COVID patients. And we can work with Alberta Health Services to get a more detailed answer to your other questions.
Operator, could you put through the next caller, please?
Michelle Belfontaine, CBC.
Hi, Dr. Hinshaw. Just wanted to follow up with you about testing. We've received emails from people at CDC asking about delays in getting a test. Like one woman told us she had a symptomatic child, and she tried yesterday to get an appointment, and as soon as she could get was on Sunday. That the notice that she got at the very bottom, it said the Edmonton zone has high testing volumes. So what's going on here? Like, are the labs overwhelmed right now, or what's the issue?
That's interesting, and I am sorry to hear about that report. The regular testing turnaround reports that I get from Alberta Health Services indicate that 80% of individuals who go online to register to get a swab are able to get an appointment within 14 or 15 hours across the province to get that swab taken. So clearly the story that you're reporting is not matching our reports, so I'm not sure if that would be part of that small outlier group, and it's something that I'll take back and look into. The assessment centres have, up until, again, my understanding up until now, been able to keep up with the increased demand for people who need to get that swab taken. We have had, of course, a large volume in our labs, and we are aiming to meet the target of having results back to people who get the swab within 24 hours ideally. Right now we're sitting at just over 48 for, again, 80% of people, so longer than we'd like, but we are working on, as we have been for many months, we have managed to bring those testing turnaround times down from where they were a couple of months ago, and we have a little ways to go. But, of course, the story that you report is concerning, and I'll ask the team to look into what's happening with assessment centres because it's different from what I understood was happening.
Michelle, we will follow up with you after the media availability is finished. We have time for 3 more questions. Operator, could you put through the next caller, please?
Kelly Kreiderman, Globe and Mail. Kelly, your line is open.
Thank you. Hi there, Dr. Hinshaw. I was wondering if you could speak to the rise in case numbers in areas outside of Edmonton and Calgary. The attention has been focused on Alberta's 2 biggest cities for a lot of the case increase this fall. But I'm looking at the numbers and I'm seeing the numbers go up in a lot of areas outside of Calgary and Edmonton. How much does that concern you?
I think over the course of most of the last 9 months, we have seen the majority of our cases in urban centres. And unfortunately, I think what's happened in the last couple of months is that the challenges we're seeing in Edmonton and Calgary are similar across other areas of the province, with people spending more time indoors, perhaps people who live in areas of the province where they didn't really have a lot of COVID spread previously may have relaxed the precautions and felt like that particular area of the province was safe. But of course, we are all interconnected, and there are many people who travel back and forth. And so as we've had, unfortunately, introductions in different parts of the province, we have seen many different municipalities across the province moving into that threshold where they are experiencing more than 50 active cases per 100,000. So I think the bottom line is that no matter where people live in the province, COVID-19 is a risk, and the precautions that need to be taken everywhere. And that is exactly why the measures, many of the enhanced measures that were put in place, are focused on those enhanced areas because we need all Albertans to watch out for each other by following these restrictions that are now in place.
Operator, could you put through the next question, please?
Jason Herring, Postmedia.
Hello, this question is for the Minister. I'm wondering if police will be enforcing these new orders at anti-mask rallies. These see hundreds of Albertans together for the explicit purpose of flouting public health restrictions.
Thank you, Jason, for that question. So my expectation, obviously, is to ensure that folks comply with the public health orders. As I said in my remarks, these orders are meant to keep all of us safe from this terrible virus. And with respect to how the police is going to enforce these health measures. As you know, the police have got the independence to make some of these determinations by themselves. But as Minister of Justice, my expectation is that those who are in violation of the measures that we have put in place would have to be held accountable. Thank you.
Operator, could you put through our final question, please?
Thank you. Yes. Dylan Short, the Edmonton Journal.
Hello. I believe this is a question for Minister Madhu, but Dr. Hinshaw might be able to weigh in as well. You said that we're going to have about 700 new peace officers being able to issue fines. However, these officers are still going to be doing their other jobs that they're already performing. I was wondering how then are they going to be, deployed in terms of enforcing these new COVID restrictions? Is it just if they come along social gatherings in their day-to-day job, or some other way of enforcing the rules? And then, sorry, a double-barrel question here, but in the past we've heard that enforcement is going to be more about education than actual enforcement, and there are a lot of new rules now that people are learning. Is this still the approach that we're taking, or do we need to enforce quicker?
So, as you know, we have, we did deploy police officers and some of these peace officers in March of this year, and they are aware of what they need to do with respect to these new measures that have been put in place. Now, there's no question education is important, and I think Dr. Hinshaw had stressed that that would continue. But at the same time, we are now faced with a very serious situation that requires that we hold people who are not complying with these measures accountable. And so you are going to see a heightened level of enforcement in those cases where there are individuals who are blatantly not compliant with the health measures.
Thank you all for joining us. There will be another COVID-19 update on Monday afternoon. Have a safe weekend.